Hi everyone, it's Dr. Peirson. Today I want to talk about a very common question we're getting at ArtMed, which is the question of nodules related to biostimulatory fillers. So first of all, I want to talk briefly about what are biostimulatory fillers. These are specific types of fillers that are designed to cause your body to produce more collagen and elastin in the skin, so to thicken, tighten, and improve elasticity of the skin. These are different than HA dermal fillers, which are designed to add volume and change the shape of your face. So the common biostimulatory fillers out there are things like Radiesse and Sculptra, and here at ArtMed we dominantly use Radiesse. When you inject a biostimulatory filler, we are putting something into the skin, in the case of Radiesse, these tiny little spheres of calcium, which then are little posts within the skin on which you are going to build collagen and elastin. Nodules form when too much calcium or too much collagen and elastin form in one spot. And the reason that can happen is if too many of the little calcium spheres are in one place, and then you get an overproduction of collagen and elastin, which leads to a nodule or a lump within the skin. So last year there was a large, what we call meta-analysis study looking at this issue, where they looked at 50 papers in the medical literature and how common is this, what can be done about it. So first thing you need to know, it is not very common. Radiesse is very uncommon. Generally, it's less than 3% of people who develop nodules, and even in those cases, they're largely preventable by avoiding the kinds of situations that can increase the risk of nodules. So the most common reason people develop nodules is that the product, Radiesse or Sculptra, builds up in an area of the skin. And the reason that can happen is there's a lot of movement pushing those little nodules together, or those calcium spheres together. So for example, putting Radiesse around the mouth is not a good idea, because as you purse your lips, you pull together and you can bring those little spheres together. Or squinting around the eyes, if Radiesse is too close to the eyes, it may increase the risk. So using talks in these areas can reduce the risk by not having so much movement, or just avoiding it altogether. One of the advantages of Radiesse, of course, is that we can also dilute it, and it comes in a gel carrier, which helps to spread it evenly and to make the distribution so that it is more dilute and not so many nodule or calcium spheres. So if you have questions or concerns about nodules with the use of biostimulatory fillers, feel free to talk to us at any time, but I do want to assure you the risks are very small, and particularly small with Radiesse.